birth, please?
Ariel Hasmaker, 9/11/01.
Okay, great. Nice to meet you. Is it okay if I perform an assessment on you today?
Of course.
Okay, sounds great. I'm going to first start by performing hand hygiene and putting on my gloves. And is it okay if I touch you at all throughout this assessment?
That's okay.
Okay, great. I'm going to first start by observing your head and neck. So I'm going to observe your facial features for symmetry. Your eyes and your eyebrows look symmetrical, as well as your eyelashes. Your ears look symmetrical. The top of your auricles makes a nice horizontal line, which is good. Your neck looks symmetrical, and your skin is a pale pink color, and everything looks normal so far. Next, I'll be assessing cranial nerve number 5, which is trigeminal. Could you please clench your teeth for me while I palpate your masseter muscle? Okay, good. And can you clench your teeth again for me, please? Great, and that was motor. Now I'm going to be assessing the sensory. So can you just close your eyes for me and let me know whenever you feel this cotton against your skin?
Can I feel it?
Okay, great. So cranial nerve number 5 is intact. Next, I'm going to assess for cranial nerve number 7, which is facial. So can you close your eyes tightly for me and raise your eyebrows? Okay, great. Cranial nerve number 7 is intact. Now I will be inspecting and palpating the head and scalp as well as the sinuses and TMJ. So I'm going to feel around your scalp. I don't feel any masses or lesion. Your hair is distributed throughout. I don't know any tenderness. Do you feel any tenderness or pain with that?
No.
Okay, great. Now I'm going to palpate your sinuses, starting with maxillary. Do you feel any tenderness or pain with that?
No.
And now frontal. Do you feel any tenderness and pain with that?
No.
And I'm also going to palpate TMJ, temporomandibular joint. Feels normal. And do you feel any tenderness or pain with that? Great. Now I'm going to inspect the neck and the neck veins. I'm going to palpate the neck. Everything feels normal. I don't feel any tenderness or see any edema. Do you feel any tenderness or pain? Great, and it all looks symmetrical. Next, I'm going to palpate and auscultate your temporal arteries. I'm going to feel them. I don't feel tender. Do you feel any tenderness or pain with that?
No.
Okay, great. Now, I'll be auscultating them to see if I hear a bruit, which is a whooshing sound. And I'll be using the bell of my stethoscope for this. I don't hear anything, which is normal. And I will be repeating it on the other side. Okay, great. Everything sounds normal. Now I'll be inspecting and palpating the neck, trachea, thyroid, and the lymph nodes. Like I said, the neck feels good. I don't see any redness. I don't feel any edema. Now I will find the trachea and thyroid above the sternal notch. It is midline. Can you tilt your head back and swallow for me, please? And it raised, which is normal. And now I'll be assessing her lymph nodes. So occipital, preauricular, postauricular, tonsillar, submandibular, submental, interior cervical, posterior cervical, supraclavicular, and deep cervical chain. And they were not palpable and they don't feel tender. Did you feel any tenderness or pain with that? Okay, great. Now I'll be assessing cranial nerve number 11, which is spinal accessory. So I'm going to put my hands on your shoulders, and can you show them against resistance for me, please? Okay, good. I'm going to do the same against your head. So can you look to your left for me, please? And look to the right for me, please? Great. So cranial nerve number 11 is intact. Now I'm going to assess the eyes. So I'm going to inspect the eyebrows, the eyelashes, the eyelids, the lacrimal gland, orbital area, pupil, and iris. So your eyebrows and eyelashes are evenly distributed throughout. They're symmetrical. Everything looks normal. I'm going to now palpate your lacrimal gland. I don't know any tenderness or edema. I don't see any redness. Did you feel any tenderness or pain with that?
No.
Great. Now I'm going to palpate your orbital area. I don't feel any masses or lesions. Did you feel any tenderness or pain with that? Great. Could you pull down your lower lid for me, please, so I can look at your conjunctiva? Okay, your palpebral is pink and your bulbar is transparent. Your sclera looks white. And now I'm going to look at your pupil and your iris. They're round, reactive to light, regular. Your pupils are clear. And your iris is a dark brown. Now I will be assessing cranial nerve number 2, which is optic, with the Rosenbaum test. And you're going to test each eye separately. I'm going to have you hold this away from you while you cover the one eye and read the lowest line possible with your other eye.
374258.
And can you repeat with the other eye, please?
374258.
Great. And you have 20/30 vision. And now I'm also going to assess cranial nerve number 2, which is optic, with the confrontation test to test your peripheral vision. So if you could look directly at me and let me know when you see your fingertips. When you see my fingertips first.
I see it. I see it. I see it. I see it. Right there. Right there.
Great. Now I will be assessing cranial nerves 3, 4, and 6. 3 is ocular motor, 4 is trochlear, and 6 is abducens. I'm going to start with the corneal light reflex. So if you look at me, pupils are aligned, they're reactive to light. Great. Next I will be doing the cover test. So can you cover your one eye and look into the distance this way with your other eye? Now take that down. And they are both looking in this direction, and there's no strabismus, so everything looks good. Now I'm going to do the 6 cardinal fields test as well as lid lag. So if you could follow my fingertip, with just your eyes while I make the letter H. I don't see any nystagmus, which is good and normal. And for lid lag, can you look directly up and directly down for me, please? Great. And I don't see any ptosis, which looks good. Now I'm going to do the pupillary reaction to direct and consensual light. So I'm going to dim the lights first, and for direct light, you're going to look forward, and your pupils constrict, which is normal. I'm also going to do the other side, which is normal. And now I'm going to see pupillary response to consensual light. I'm going to start on the one side, go to the other, and they constrict, which is good. Now I'm going to be doing pupillary response to accommodation. So just follow my fingertip to your nose. Great, so everything looks normal for the eyes. Now I will be assessing the ears. I'm going to inspect and palpate the ears. I don't feel any masses or lesions. I don't see any tenderness. Do you feel any tenderness or pain with this?
Mm-mm.
Great, and they look symmetrical. Now I'm going to be using the otoscope to look at the ear canal and tympanic membrane. And I'm going to be pulling your ear up and back. And I see a little bit of cerumen, no foreign bodies, and tympanic membrane is pearly gray, dull in color, intact, and free of tears. I will be doing the other eye, pulling it up and back. And same on that side, pearly gray, and just some cerumen, no foreign bodies, which is normal. Now I will be assessing cranial nerve number 8, which is vestibulocochlear, and I will be doing the whisper test. So I'm going to stand behind you and saying a chain of numbers or letters while you close your right ear for me, and can you repeat it back to me?
Mm-hmm. 1, 2, 3.
And I will now be doing it on the other ear. And can you occlude your left ear for me, please?
4, 5, 6.
Great. Cranial nerve number 8 is intact. Now I will be doing the Rhine and the Weber test. So for Rhine, I'm going to hit the tuning fork, put this side against your ear. You're going to let me know when you stop hearing the vibration sounds, and then I'll be putting this side against your ear, and let me know when you stop hearing the vibration sounds.
Okay. Okay.
And now I'll be doing it on the other ear.
Okay. Okay.
And now I'll be doing the Weber test, where I will hit the tuning fork against my hand, put it on the top of your head. You're going to let me know when you stop hearing the vibrations, and if you heard it better in the left ear, the right ear, or equal in both.
Mm-hmm. I can hear it equally on both sides.
Okay, great, and that's normal. Well, that's it for our assessment today. It was so nice meeting you. Do you have any other questions or concerns?
Nope.
Okay, great. I will now be taking off my gloves and discarding them. And I will be performing hand hygiene.